Good morning. Hi. Okay. Good morning. Hi. Morena koutou. I think he's just being gathered from outside. Hi Liz, how are you? That's all right, we understood. Thanks for flagging it with us. Good morning, is it Katy?
Yes.
Hi Katy, please come up to the table. Yeah. Katy, you've heard the format. My name's Dr. Shane Reedy. We have Matt Ducey, Angie Warren-Clark, and Dr. Liz Craig with us as well.
Hi.
Please take it as read that we've read your submission. The time is yours. You have 5 minutes. I'll give you an indication as we get close to the end. But the time's yours, Katy. Please go ahead and eat the microphone.
Okay. Hi, my name is Katy, and this is Eddie.
Hey.
Eddie. What's that?
That's a microphone, my friend. Your mummy's going to tell us maybe about you, I suspect. But go ahead.
A little bit about Edward, but it's also about me. So I didn't really include anything about myself in the submission because I just concentrated on the change in Edward's life. Yes, my love.
Where's Granddad?
Granddad's just if you want to go and say hi to Granddad, my background is I'm a TV presenter. I used to be the editor and owner of an international magazine called Luxury Living. I'm educated, I'm professional. My parents are here with me, so is my aunt. My aunt works at Auckland Hospital. Prior to that, she worked for the St. John's Ambulance and the Territorial Army. My stepdad is ex-police and he's a lawyer. My mum is the chairperson of many Catholic boards and she works in aged care. I'm really concerned that a lot of the rhetoric seems to be around sort of criminalising patients, and personally it's been a challenge because I was really concerned that Edward's seizures were going from a couple of seconds to a couple of minutes to then it was 7 minutes, then 11 minutes, and we were pushed down a path that was actually exacerbating his condition. But I was too scared to explore medicinal marijuana because of my own preconceptions and because I didn't want to dope my baby. And if the rhetoric around it had been different, I would have acted earlier and we wouldn't have spent so much time in ED. We wouldn't have had to catch so many ambulances. A year ago, Edward was the subject of the Royal Australian Physicians exam for paediatricians who are going to specialise as doctors later on. And Edward was examined with global development delay and given an average age of 1. And he was 2.5 at the time. He couldn't run, jump, string more than 2 words together. His behaviour and overall self-care he was basically a 1-year-old. Since I started using CBD, as you can see, he can walk, run, talk, jump. He wears a little Batman suit that he wanted to wear today to feel brave. It has flashing lights. A year ago, that would never have been possible for him because it just would have been a trigger and that would have been it. He also wouldn't have been able to cope with seeing this many people in the room. Instead, as you can see, he's just excited and kind of wants to play. And I feel as though the law as it currently stands and the amendments that are being proposed are missing out on serving the majority of people. I lost a cousin a month ago to suicide. It was a huge surprise. He was studying here in Wellington. He was very close to finishing his law degree at Victoria University. He was popular, athletic, talented, gifted, had everything going for him. And if we look at the suicide statistics for this country and we look at how many people are suffering from depression, anxiety, I myself suffer from depression and anxiety. It's situational, obviously. And because also I'm severely sleep deprived watching this guy all night, every night. But I can't... You can look at the la la la, and if you want to sing them a song, they would love that. I can't take the lorazepam that's prescribed to me for the panic attacks that I've started suffering since Edward started having epilepsy, because as it metabolizes in my body, if my sleep is disrupted, I become irate to the point of aggressive, which I cannot ever become. It's just not a risk that I'm prepared to take for Edward. But unfortunately, there has been an occasion in the last year where Edward has had a seizure, and I have also been paralytic on the ground with a panic attack. I'm unable to help myself.
I don't want.
And I don't think I'm alone. I think caregiver stress is something that the majority of caregivers suffer. And even with respite care, it's never going to be enough because it's a 24/7 job. You don't, even when you're given a break, you still have to go back on the clock. And I think that opioids and benzos, and I can't, if I wanted to go to work and take them, I wouldn't, because they make me feel out of it. And it's just not professional, and it's not something I can do. So I walk this really fine line when I do show up to work that, what if I have an anxiety attack? What if I have a panic attack? And, that could be my last job, or especially with Edward and his care. Yeah, you can go to one.
Katie, can you take a few questions?
Absolutely, yeah.
Thank you. I might pass to Angie Warren Clark.
Well, thank you for your submission and for bringing all your family here, and your little fella. He's looks like he's having a good time today. First and foremost, thank you for your story and for sharing that with us. In terms of the CBD, cannabinoids, do you believe that cannabis that should be a fully subsidised system, access to, or do you believe that it should be regulated through doctors?
Look, I honestly think that if you can fully subsidise it, that would be ideal, because currently I'm spending thousands, and I know very few people who can afford to do that, especially if you're in full-time care. And I'm not even talking about terminal patients. There's such a broad spectrum of people that can be helped. It can be mental health, it could be like a neurodegenerative disease and mitochondrial disorders, and people like Edward who have an unnamed genetic condition that we still haven't gotten to the bottom of it. So fully subsidised would be amazing. But the reality is, like for Edward, he has to have an organic diet, because we've found that some sprays and some additives can give him seizures. So my solution to that is I grow his own vegetables and I cook his own food. I should be able to do that with his medicine as well, because the only way I can really control what's going into him and the quality of it is if I make it myself. And, I feel like the majority of patients should be able to look after themselves, or their caregivers should be able to look after themselves as well, because what I have learned is that CBD in itself, as an extract, as an isolate, is not enough. Edward needs the whole plant extract. And what I would love to be able to do is just put it in his smoothies, put it into his food, make a salad, make a soup, and just give it to him raw, because the more I read about it as a raw plant, it seems like a superfood. It seems like the stuff that I'm giving him anyway. And when I purchase it, I'm really taking the person who's made it they're given that there's no THC in it, but we know that with decarboxylation, you're heating the plant and it degrades over time anyway. So if there's even like a small percentage of THC and it's old, do you know what I mean? Whereas if I made it myself, it was fresh, then there's no chance. There's absolutely no chance. But when you're buying it from other people and it's coming from overseas, we've been caught short many times, and those times have just been horrific, because you don't know when it's going to end.
Liz, last question with you.
So just thinking through what you're saying, that the legislation as currently proposed, you think is too narrow and doesn't serve the needs. So just highlighting again what your recommendations would be to this group in terms of changes.
I think that patients should be able to grow it themselves, and I'm sure if there are concerns around that, you guys can form some really robust laws to make sure that everybody's needs are met. And we're not talking about like grow a whole farm, we're just talking about enough to keep going so that we're never caught short. Full subsidisation would be fantastic because, I mean, Edward, as it currently stands, I'm spending thousands of dollars on. He only weighs 14 kilos, and his dad was tall and big. So his consumption's only going to go up over time. And, you know, if you're treating adult patients, I assume that their consumption is higher as well. And when you're bringing it in from overseas, you know, you're always paying a premium. So, yeah, I think subsidies would be fantastic. And I do think we should be able to grow it ourselves just like any other vegetable or plant.
Matt's pointed out a unique perspective you have, so Matt, you do have the last say.
Yeah, thank you very much. I just wanted to ask if you could talk a bit more. You're probably one of the few people we've spoken to. You've actually made an active decision as a parent to take Edward off pharmaceutical medication.
Yeah.
So that's. I'm just interested in how that played out with your relationship with the medical staff you're engaging with, and what that looks like for someone faced with that.
It's not fun. It's really not, but I've always been a terrible liar. So I didn't really have the choice. I was always completely honest with them, and I kept them up to date. So every time I met with our overseer, so Edward has a ton of doctors, and every time I met them, I explained to them that I was always exploring other natural therapies. So Edward sees an osteopath, he sees a cranial sacral therapist. We've always been exploring different diets and lifestyle options and exercise. And, you know, Edward doesn't screen, he doesn't watch TV. So I always kept them up to date with what I was doing with Edward. And I just kept reiterating how unhappy I was with the results I was seeing with the medication as we were titrating him up. And also I was documenting everything. I've documented pretty much every minute and day of Edward's life since he was alive. So I had videos and like medical notes of his seizures, and it was really clear that the medicines weren't meeting his needs and they were exacerbating his condition. And Edward's wellness was going down, his weight was going down, his cognitive function was going down, his coordination was going down, 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 down. My calls to the hospital were going up. My visits to the doctors were going up. And I'm not sure that they were happy when I said that I was taking him off the medication, but they knew that was the road I was going down because I'd exhausted every other option that was available to me and over a period of time. So it was over a long period of time. And for me, the risk of losing Edward just far outweighed just towing the line and, you know, giving him what I was told to give him. And then, you know, a month later I was ratified by my decision by our own neurologist. So, yeah, it's incredibly difficult when you get so much pushback from your GPs, from your doctors, from the experts in your community. But they've also since come back to me and said that they want to learn more. And I've seen those same doctors at health conferences. And, I mean, they're not to know because I think the endocannabinoid system was only discovered in 1990. So if you've been practicing, you know, for a long time before that, it just wasn't part of your qualification when you study to become a doctor. It's not their fault, but, you know, we know more now. And it is a really gentle, safe therapy. And, you know, just the fact that you can't die from it, I was just so scared and terrified that, you know, Edward would become an Alex Renton, and he's my greatest achievement. I can't afford to lose him. And I don't want any other parents to have to lose their child. You know, I think if you focus on the negatives, you're going to miss the opportunity to save so many people, so many children like Edward. Like, he's got a bulldog for a mum. I'm like a dog with a bone. I don't let something go. But not every mum has that. And, you know, if you've got multiple kids and multiple kids with special needs, you probably don't have the wherewithal or the energy. Or, you know, I was lucky enough to have people sending me, you know, randomized clinical trials. I had people sending me medical information, and they wore me down whilst Edward was in hospital. And I was just so tired and sick of Edward being sick. And as soon as I tried it, it worked. I have a video on my phone that I can show you. Like, it's instantaneous. As soon as you put it in his mouth in the middle of a seizure, it stops it. And he has epilepsy, but I'm pretty sure it has therapeutic benefits for a whole bunch of other things. Like, my understanding is so narrow, but I think the applications are really broad, and you guys have so much power here to help so many people. We may do something.
Katy, thank you very much for coming in today. Thank you for bringing in Edward. I understand that. Thank you for also bringing in your support team. Now you're going to get us upset. Don't go there.
I thought there was only going
Don't even
to be
start.
3.
Thank
So,
you.
I'm sorry, I only bought 3.
You want us all to be upset?
Thank you very much.
Thank you very much. Okay. You get it with the signing for us if you would, please, eh? There's a pen. Thanks. Okay, I want you to keep moving just to the committee. I will actually rotate the questions around very frequently. I'll do my best effort to sort of spread them around, but we do need to.
I was ready for me to go first.
I know, we do need to respect other people's time. Thank you very much. Now, do we have Amanda? Yes, do we have? She? Okay, let's do that. We'll go to Jenny Kelso on teleconference committee.
Kelly's a cream. We're going to the docs.
That's all right.